My name is Ward Blanchard. I'm CEO and founder of the Blanchard Institute, a human service professional for nearly 20 years. I want to talk to you guys about a sensitive subject when it comes to the treatment process and the best prognosis for individuals to heal, especially when it comes to young adults. I classify young adults approximately ages 18 to 30-ish. And what I mean by that, and with an understanding of how their brain heals, it is most important for families to understand that patients who are in the early stages of healing, the early stages of neuroplasticity, when they're young adults, that the best and most optimal environment for their brain to heal is outside the family's home, outside the parent's home. And that has nothing to do with how healthy the environment or healthy the parenting is, and has everything to do with the best environment and most optimal environment for the brain to heal. Because when you're talking about treatment for a young adult, treating a young adult and treating anybody in essence, but especially a young adult whose brain is still growing and healing, what we know and what we understand is the goal is far more than just stopping the chemical consumption. The goal is to help them to become autonomous, to help them with their period of brain development. If they're in that stages of 18 to mid-20, the brain is still going through stages of development where they need to have an autonomous environment to assimilate into. And regardless of how healthy your parenting is or how healthy your environment is, when somebody turns 18, that when they have the cognitive issues of healing from a mental health disorder or healing from a substance use disorder, that we know that all of our evidence shows that the healthiest of environment happens outside the parent's home. That's how they heal. That's how the brain, develops esteemable acts. It's very important to understand that. And most of the time, let's be honest and have an uncomfortable conversation, that in today's day and age, those individuals who are still much older, still living in their parents' basement, whether you call it failure to launch or failure to thrive, let's be honest, that's about the parents. It's not about the child. That's about the parents' inability to adapt that child going from a dependent to an independent. And they need to let go and adjust their relationship. That's in a normal environment. But you throw in the factor of the cognitive dissonance that happens with healing from a mental health issue or healing from a substance use disorder. The clinically optimal environment happens in a properly vetted, structured recovery residence that is gender specific. All of our evidence shows unequivocally that that provides the optimal environment. It doesn't mean that it can't happen. That's not what I'm saying. It's not a polarizing statement. I'm just communicating that in most situations, the optimal and best prognosis happens when that identified patient and for their brain to heal happens outside the family's home.